No, but I'm here.
Was that you, Tom?
Yes, it was.
Okay, somebody with the recording was speaking over you. We're all present. Missy, could you say your little spiel, please?
Okie dokie. As a preliminary matter, this is Missy Cackler Boyesfart, Senior Administrative Assistant to the Mendon Board of Health. Permit me to confirm that all members and persons anticipated on the call on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Andy?
Yes.
Tom?
Yes.
Alan?
Yes.
Okay. It's my understanding that the selectmen were posting for tonight. I know Lonnie's here. Are there any other selectmen on? Okay, I'm going to take that as Lonnie's the only one. Good evening. This is the open meeting of the Mendon Board of Health. Is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with the agenda materials for this meeting, allows the public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment. For this meeting, the Mendon Board of Health is convened by Microsoft Teams, as posted on the town's website, identified on how the public may join in. Please note that this meeting is being recorded and then some attendees are participating by video conference. Accordingly, please be aware that all folks may be able to see you, and that takes care not to screen share your computer. Anything that you do broadcast may be captured by the recording. All the materials for this meeting, except the executive session. Oh no, I don't have to do that one. I don't do. All supporting material have been provided to members of this body, are available on the town's website unless otherwise noted. The public is encouraged to follow along the posted agenda unless the chair notes otherwise. Basic meeting rules. We will now turn to the first item of the agenda. Before doing so, permit me to cover some ground rules for effective and clear conduct of our business and to accurately ensure accurate meeting minutes. The chair will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members and inviting each by providing their name by each name to provide any comment, questions, or motions. Please hold until you are called. Further, please remember to mute your phone or computer when you are not speaking. Please remember to speak clearly in a way that helps generate accurate meeting minutes. And with that, I'll let you start, Andy.
First off, I'd just like to thank everyone for all these weeks of this phone calls and computer meetings. Recently, I've had opportunity to listen to a couple of other unrelated Board of Health, unrelated meetings, and it was a crap show. People talking all over each other, and the format in which we all conduct is really makes our meetings go very well, and I thank everyone for all your help. So that being said, I've had opportunity recently in two situations to speak with two different health agents, not from our town, and in unrelated Board of Health business, just through my job, and both individuals, not knowing each other, had the same comment comments about the way that this pandemic has been handled, both by the DPH and the CDC, and both of them felt pretty much like all of us at one time or another have felt. It's all new territory to all of us, and things change. We look like fools sometimes when we get handed directions and this is how things are supposed to be handled. And then a minute later, it seems like, everything's changed. So now everybody's pointing fingers at the Board of Health saying, we really don't know what we're doing. We're unapproachable. We don't, it's not us. And we all know that, and we're doing the best we can. So I just want to say thank you to Tom, Alan, Missy, Lonnie, and everyone else concerned that's tried to get through this all together. It's a very tough time for all of us. And second of all, congratulations, Lonnie. And I'm going to go to Tom next, please.
Well, if we're talking about the first topic on the agenda, is COVID-19, is that the focus at the moment?
Yes.
Well, with regard to that topic, I don't have any opening statement. I would just offer my congratulations as well to Lonnie and to fellow board member, Mr. Greenberg.
Oh my God, I forgot you, Alan. I'm sorry.
Back to you, Mr. Chairman.
Thank you, Alan.
Well, thank you very much. Much appreciated. I look forward to another 3 productive years with everything that we got in play and will be put in play eventually. And definitely congratulations, Lonnie. I know you've got a tough 3 years ahead of you. I feel as though we've done a good job. It's the first time for all of us handling something of this scale. And I've heard, some positives. So I'm going to make believe I don't hear the others. And I'm going to pat ourselves, all of us, on the back and say, good job. I have noticed, and AJ made a comment a couple meetings ago, that the traffic and the rage is definitely back. It's not pleasant out there anymore. I was actually enjoying it for a little while, but other than that, I'm hearing good things. I'm seeing good things out there with the restaurants putting up tents and trying to, follow the guidelines and get back on track and get their employees back to work. So I'm very encouraged by what I'm seeing out there, and I hope to see more of it. Back to you, Mr. Chairman.
And don't get me wrong, please. I am very proud to be on this board with my members that are present and Missy. We are all doing the best we can, and I'm pretty proud of the way we do things. So those comments that we hear that are negative, like yourself, Alan, I try to put them in a place where they belong. I learned a long time ago, you can't please everyone. We're all doing this job for free, and nobody's stepping up to run against us. So we just have to keep putting one foot in front of the other. I think that's, Missy, do you have something to add to all that, please?
I would say the only thing I have is I agree with you. This is definitely a very tedious time. It's a very confusing time. There's many times I've been on calls, as I've told you, with other health departments, and they're equally as upset. They're equally frustrated, and they're getting ready to throw their hands up also. There's a lot of guidance that comes down that we believe we're heading in the right direction, and then the next thing you know, they change it all, or they make it not so clear. We actually, for the first time, got them to say, yes, we screwed something up when they came up with the distance for tables for the outdoor dining. The way they wrote it up, it was 6 feet from table to table. And when one of the health directors asked them, that's not keeping people 6 feet away, they said, yep, you're correct. They'll actually probably be 3 feet away. and they messed that definition up. So at least once the state actually took blame for something. I know Lenny has been going around visiting the different establishments. We made up packets last week. I put labels on them for Lenny so he could, go know which restaurants and whatnot to go to. So far, the ones he's visited have been very receptive. They've been obliging. Hopefully they understand that he's just there to do the job that was handed out to him. So for now, that's all I have for you guys.
Is Dan Byer here?
I'm here. Can you hear me?
Hi, Dan. Thank you for joining us. Missy had some questions for you as far as your opening.
Okay.
Dan, I just wanted to clarify when we were talking to Lenny. So just so you guys know, Lenny and I met with Dan at the beginning of the week. We were going over his plan and what he was doing. Lenny had some questions and stuff. So Dan made corrections or, took the suggestions and whatnot, redid whatever Lenny suggested. My only question is I just need clarification, Dan, when it comes to the employees that are going to be the lifeguards, the snack shack, the camp counselors and whatnot, are you guys going to be providing PPE for all of those kids, or do they have to come in with their own? I can't remember.
So I believe that we have a right. We have to provide PPE to our employees. I don't think that's negotiable. We're going to suggest that they bring stuff from home. All we really can offer are those surgical masks, and we will have some higher level stuff for first aid situations. But day to day, we can provide those blue surgical masks. If they want something fancy, like a nicer mask, that's on them.
Right, above and beyond what you're willing to. Okay, I couldn't remember when we were talking, and I just wanted to make sure I got that clarified. So, I don't know.
Okay.
I sent out to the board members your revised plan. I don't know if anybody has looked at it, and if so, I don't know if anyone has any questions or concerns for Dan for tonight.
I don't. I have not seen the email. I dropped the iPad. I do not get emails on the phone, so as of right now, I am run silent, run deep. Do not get emails. Tom?
No, I think, Dan, I think you're in good shape. I like what's being presented. I don't have any particular concerns at this point for you moving forward.
Alan?
I'm very trusting of Dan. I have not had an opportunity to review the revised plan though. But I know Dan is on the ball and anxious to get open and willing to do whatever he needs to do to get that done.
And I'm sure you'll do a good job, Dan. So we all have the utmost confidence in you, and thank you for all you do.
Well, thank you. I appreciate it. And if there are questions, send them our way. We still got 2 weeks to kind of figure everything out. So if something comes up, definitely let us know.
Awesome. Thank you. Missy, can you see who else is on the meeting?
The only other people that are on are Lonnie and Kim.
Okay. Welcome, Kim. Do you have something to say to us?
Clicking all my buttons. I just really called in case there were any follow-up questions to the licensing stuff for this week, and to thank everybody for really the same sentiments as earlier, working together really quickly to help expedite reopening the businesses that we can per the governor's orders. I think that was really important to everyone, and I'm really glad and proud, honestly, that Mendon was able to do that so quickly and all together. I think that really says something about how we've been handling this. I know Missy and I were just on a conference call together on Friday for small towns, and I think the expectations are, because we are, surrounded by maybe larger communities, there are some standards and expectations that go with that. And I think as a small town, we've really been keeping up with much larger communities at the pace in which we are trying to, accomplish and serve the public and, do these inspections and do everything. And so I think, and I think if you are getting negative feedback at all, I mean, I think it's really important to keep in mind that it does change day by day. That is 100% true. And I think people just don't understand the amount of work that we are doing during this and what it takes to really operate a community. And so after this, believe me, I think the entire town will owe you a debt of gratitude for the amount of work that's been done, especially Missy. And I think, I won't forget, and I'm sure a lot of people won't forget. That's all.
Thank you very much, Kim. Appreciate it. Lonnie, do you have something to add for us, please?
Nothing spectacular or specific. It's just great to see that the restaurants are open, and the other businesses that were able to add to the areas that they might not have been able to open, such as the drive-in and whatnot. So it's just nice to see all that. I'm just very happy it's finally happening.
Oh, and by the way, when the steakhouse opens, you owe me a beer because that one vote was mine.
Well, there has been a recount asked for, so we have to go through that process. But yes,
I'm sure there was that close. Sure. That won't change anything, I'm sure. Cool. All right. If we are done with COVID, yes?
Well, kind of done with COVID, but kind of not. So I've spoken to all of you individually about, because of everything going on lately, Lenny has been struggling trying to keep up with the septic inspections. So I reached out to Tom Ryder, and I reached out to Andy did actually, reached out to another gentleman who might be able to help us just to get through this right now. Tom Ryder, who is our Board of Health engineer, who reviews our septic plans and our as-built plans, right now is willing to help out, take on the additional right now to help out with those inspections, to help alleviate some of the issues going on for Lenny with all this extra COVID and other things. But Tom is scheduled to have surgery on his back soon. So we did reach out to a gentleman by the name of Steve Donatelli. For those of you who may or may not be familiar with Steve, Steve worked for Shea Engineering here in Mendon for many, many years. He has gone out on his own. He's actually the Title V guy for a number of communities around here. Steve said he would be willing to help out for right now, to help if he was needed. He gave you guys a proposal. As I told Andy, that if the time comes where Lenny will no longer be able to do the septic inspections and perk tests, we would have to advertise that position. But this was just a quick, in case we get into a bind situation, we do have someone else who's willing to help us. But again, if this turns into more of a permanent thing, we would have to advertise it. Kim, am I wrong in that thinking?
Yes, we would have to advertise.
Okay, that's what I figured. So just more of an FYI for you guys. And I think that's all I have for COVID right now, Andy.
As far as Steve Donatelli, you two probably remember him. Steve's a great guy, very well qualified. As we've all known, excuse me, Lenny works very inexpensive for us. And when he leaves, for whatever reason, he's going to be sorely missed because he affords us a great value of knowledge. He's known as, what the heck do they call him? Missy, help me out. What do they call him in the state?
Do they call him?
The legend.
The legend.
The legend.
Yes.
Lenny's well known in the state, and he works very inexpensive for us. When he leaves, we got a slight test. I don't know if you guys saw an email from Missy. She told me about the price differences. It is substantially more expensive to get someone, I don't want to say more qualified because they're equally qualified, but if Steve got the job, the numbers she was telling me are substantially more. So if and when that day comes that we need to make a change, we have to be prepared that, and again, we have to advertise, and I'm assuming that anybody that would step up to the plate and apply for this job would be of equal caliber as Steve and probably the same money. So we have to be prepared for that in our minds, and then whatever steps we need to take to get that passed through. So for right now, we have to cherish Lenny. Temporarily, Steve and Tom Ryder, like Missy said, is going in for surgery, are going to take out the overload for Lenny while he's doing restaurants and stuff such like that. But Lenny's going to go back doing perk tests and septic installation inspections and stuff. So this is a temporary thing, but I just wanted to say that there's the change is coming. Lenny's moving on in the years, and we have to be happy and proud that we've got him for now. Missy, was that it on COVID?
I think it is. I think we're set with COVID. One more thing. I had talked to Kim. I sent an email out. Alan Tatro actually had approached me last week about doing a code red about the metal dumpster. So I told him I would help. And then I reached out to Kim and said, would this be a good opportunity for us to not only announce the metal dumpster opening up, but there was the resuming of the bulk pickup, the pink bag program, maybe let the residents know that the library is open for no contact pickup and drop off of books. And then I reached out to Dan and asked him what he wanted. I might not get everything Dan has in his, but I at least to give some people a general idea of what has, kind of what's starting to come back as far as town services, so to speak. But we would also add that the town buildings are still closed to the public. And again, we ask people to look at the Mendon website along with DPH and CDC. Tom, I sent you an email with the wording on it if you want to take a quick peek and let me know. And then I will get it all together and send it off to Nick and hopefully have it out for either tomorrow afternoon or Friday afternoon.
Yeah, okay, I was just reviewing it quickly. I'll put some eyes on it and get a couple things back to you, Miss.
Awesome. Thank you. I appreciate it, as usual. And I think that's really all I have for COVID.
Mr. Chairman, if I may.
Your turn.
I have a couple of questions. One question is, do we have a current count on cases in Mendon that are active? And how is Ann Labonte doing?
As far as I know, Ann's doing well. I've had a couple of questions that were called in to us this week. I sent them off. She took care of them. The last time I talked to her, we only had 2 active cases right now. We did have a total of 6, but 4 are quarantining out of state. So she only had 2 actives. That was a week ago. So depending on when they came online or what their situation is, they could be getting ready to, come out of it, so to speak.
Thank you.
No problem.
Good questions, Alan. Thank you. There was another one along those lines, but it's gone. Didn't write it down. The scholarships.
Yes.
How many people applied?
3.
And we have 2?
Yes. You have 2 from Nipmuc and 1 from BBT.
All right. As I said, I don't have email access right now. Tom and Alan, do you have any thoughts on the, have you had opportunity to read them? Tom?
Yeah, I had an opportunity to quickly peruse them a little bit. So I have an idea. I don't know, when would you say we would need to make a final decision? We need to do that tonight?
I would say the sooner the better. They've already kind of graduated, so to speak. They've already had their awards night. So, we could wait till the 24th. I still got to ask Mike for a check so that we can distribute the funds. But if you want to wait till the 24th, that's up to you guys. We can do that.
All right, if that's an option, then hopefully by then I'll have an opportunity to read them myself. Alan, how do you feel about that?
Yeah, that would work well for me too. My town email is kind of locked up right now, so I haven't had an opportunity to review them.
All right,
Andy,
very good. Yes.
just so you know, for the 24th meeting, you will have the scholarships, whatever COVID information. I also tentatively put on a local upgrade for 18 Taft Ave, and there's a variance request for 8 Hastings Street. Both require a butter notification. I gave that information to Fred Lapham for the 18 Taft. I will let the engineering firm, it's Grady, I'm not familiar with them, so I will let them know also. But Tom hasn't given me a memo, but I'm just trying to get these things done so these people can move on with their projects.
Yes, thank you. Go ahead.
Huh?
Someone trying to say something? Okay. With the butter notifications, they're going to be notified of this procedure that we have for meetings, right? To call in?
Yes, they have to be.
Yeah, okay.
Have that information. They'll be, because I already posted the agenda with Ellen, so she's already got it set for that night. It's just a matter of their engineers. Now, if their engineers don't do the notifications in time, that's on them, but at least I've given them the information they need so they could move on. Because 8 Hastings Street is, because it's a variance, has to go to DEP after it's done with us.
Why is that?
That's how variances are handled.
Oh, really? Okay.
Yeah.
I was thinking it was near water. If in fact the engineers do not get the message to the abutters in time, whereas there's a local upgrade on Chief Grady's, I know it only impacts his well, if I remember correctly, but isn't that does that impact any of the neighbors?
I thought Tom said it did.
It did, okay.
Yeah.
And that's why the notification, all right.
Right. Otherwise, we
if-
could just schedule it for any meeting, and I would have had you guys do it by now.
Right. But if in fact the engineers do not get the message out to the neighbors in time and they miss the meeting,
Mhm.
does that cover us? I mean, if one of the neighbors had concerns?
I think it's a gray area. I'd have to double check with Tom Ryder.
All right. I just don't want any of the neighbors to be slighted by not being invited to join the party.
Exactly.
Okay. Would you do me a favor and check with Tom on that, please?
Absolutely. I'll email him in the morning.
Thank you. When is he going in for his surgery?
Actually, the 17th, he told me today, the 17th.
Okay.
So he actually has 2 perk tests scheduled for next Monday, next Tuesday. I think we had a total of 5, maybe 6. Lenny's doing 2 of them next week. 1 more they're waiting to hear back from the applicant, or the applicant's engineer, I should say. There's 1 more that's coming down. Anyone who has called, I told them we're a couple of weeks out, just to make sure I had everything settled with you guys first.
All right. So if Lenny is still jammed up with everything that's going on with restaurants and stores and stuff like that, and Tom is going in for surgery, when you had your conversation with Steve, is he able to accommodate even on a temporary thing until we finalize something with him? And also, if he is, funding, because he's substantially more money than Lenny is. We have that availability. I think we discussed that. You and I discussed that because COVID would cover what Lenny's doing, and that would cover Steve because Lenny's not available. Is that correct?
That's what I'm waiting to hear back from Connor as far as the monies that we received. whether or not the $3,000 we received. I'm not sure. I'd have to defer to Kim as far as whether or not the CARES Act money would cover that.
Yeah, I can jump in here if you want. Absolutely. I mean, if there is, I haven't submitted the entirety of the CARES funding. The deadline got moved to Friday. So if you need additional funding, we should definitely put it in there.
Okay.
That's the best way to get it. But I will also say this to you. You need coverage to provide a service for the town. We're going to find a way to make that happen, right? So this isn't something we can afford not to do. So temporary, whatever, we will make it happen, right? So, and we certainly have funding within the actual budget to figure out a way to do it too. There's no way we would have a lapse in service for this.
Thank you. Thank you for that info. Excellent. Good news. All right. Does anybody else have anything to offer? I think we're done for tonight.
One thing, you ask anybody else, you didn't ask about me.
I said anybody. You got somebody.
I've been yapping all night, so. Alan did send me a thing that I emailed off to you guys regarding, he had talked to Max. So Alan, I will defer to you to talk about it.
Okay, Max did most of the work on this. My portion was reaching out to Jane Belleville, reaching out to the Ag Committee. I talked to my own vet who just came and inoculated my horses. And Max pretty much covered it all. I think the only suggestion was from Jane Belleville of Washington Street, was another source for the vaccine, which was valleyvetsupply.com. So, you know, in my opinion, it's set to go. And if we could get it up on the website, and if we could make, 10 or 12 hard copies, I would try to distribute them to places I know that people in Mendon go to buy their feed, like Feeds and Needs in Mendon. I would see if maybe Koopman in Uxbridge would be interested in posting it in some fashion for their customers, because I know they sell a lot of grain, and hopefully we'll get everybody's attention. But Max did a great job getting that thing rolling a couple of months ago already. So it's time to get it out there. Thank you.
Good news. Thank you for that, Alan.
Could I say something on that too? Alan, or anybody on the board, do we know how many horses are in town? And if so, one other question, Alan, what is the cost of the vaccine?
I could only tell you what I pay, and I'm probably paying in the $50 range because I'm having my vet do it.
Yep.
The vaccine itself, from what I understand, may very well be in the $10 range.
Yep. Okay. So kind of what I'm saying is, if we knew a list of animals that we have in town, which I think we do, right? Does the animal inspector keep that?
Yes, we have what's called I'm sorry, I'm talking over you.
No, go ahead.
We have what's called a barn book that we have to complete usually in the fall, and Max takes care of that. So we have a listing of all animals in the town of Mendon.
Okay, cool. So I think it would just be maybe we reach out to them, make sure they are getting it. If somebody's not doing it because of a financial reason, that we will get them assistance. Whether, the last thing I want to do is have another, dilemma like we had last year where we had to, shut everything down there at the last minute. And over, somebody not spending $50 on their horse, So if we can try to help that, then by all means, I'll find people to donate, or myself, or whatever. You know what I mean? I mean, if we're talking a couple of horses, I'd rather spend the money to do it.
I'm in agreement with you, Lonnie, and I think that we could probably find the monies, because it's probably not that much. The problem Max runs into is not all animal owners are on the list. There's a lot of backyard animal owners that aren't on the list. And so a lot of times there are just those unknowns out there. And most likely what happened last year was one of those locations that was unknown to us.
Lonnie.
Yeah.
He's also met people not allowing him on his property, which tends to be an issue. He does call the PD and ask for help from time to time. That's a rare occasion, but it has happened. And there is also another thing that, just like people, some people don't want their horses vaccinated. They don't believe in the vaccination. So it's a tough, it's a slippery slope. It's horrible. And if in fact there was an opportunity to help people out, I would certainly donate for that to help people if that's the case.
Yeah, that's all. That's if anybody does need help, that just that we could. No, you're right though. The whole backyard thing screws us. I'm sure.
And that barn book that he does every year, he goes around to all the known places that have any animal, whether it's chickens, turkeys, pigs, goats, whatever. And I believe it's in triplicate in this book, and he fills them out, and copies of that go to the state, so the state is aware of the animals that are present in the town, so that they have, open door policy, if you will, so we know what's going on. All right. Anybody else?
I have another topic that's related to that, actually. Just you can.
Okay.
So it's just like an idea that's being tossed around. So, and it's related to the mosquitoes and the spraying. So we had a larger turnout at the election than I think we were anticipating. And we were planning on having town meeting, and we are planning on having town meeting in the auditorium at the school, and that can fit 100 people. And we have overflow capacity like to 50 people, et cetera, in the other rooms. We certainly weren't anticipating having 800 people show up, but there is talk today about moving it outside, and which seems like the most logical because the date's already been advertised. But the concern about moving it outside is the mosquitoes and the triple E. So I guess I'm asking, how serious is the threat on June 29th of mosquitoes? And is there anything that we could potentially do right now to help ease people's minds so that we can move outside? If you guys send me in the right direction, or a mosquito sprayer I can talk to, anything like that.
There are companies that will come in and spray. They do complete yards. There are local right here in town. One of Alan's neighbors does it. And I don't know what the cost is. That would be, it is temporary. It all depends on the weather also.
Right, it'll rain then. Right?
No kidding.
Right. I mean,
Alan,
what about the risk though right now? Is the risk particularly high this time of year?
Not yet.
Right. So
it
really,
has not been documented.
Right. It's more of an annoyance at this point, right? So bug spray on people attending should be enough to suffice from just regular old mosquitoes.
Yes, and Ian Mazar has had these flyers up for a long time. Long, and again, June 29th, could be warm. Long sleeves, spray, the whole 9 yards. Common sense.
I think if we told people that we like triple E isn't, known for this time of year, but we do have, recommend that you sleeves, blah, blah, blah. I think that could probably be enough, assuming that we do have to go outside, or plan
If I'm not mistaken, Kim, I think that the only reason why it's not prevalent this time of year is because, as we all know, the mosquitoes just recently came out of dormancy, and they're just starting to come around for the past couple of weeks. Mm-hmm. So testing, just like COVID, testing is just starting in the surrounding towns around Mendon, because we keep getting shut down to try and get the mosquito control project in town. So we have to go by what's happened, and they do come to Mendon and test certain vernal pools and stuff like that. The state does, but as the testing goes on, that's when they find out where the triple E is. It's probably here. it just hasn't been detected yet.
Right. So, I mean, do you want to make a guess on what the risk is that somebody's going to get it at town meeting?
No way. I ain't touching that one.
Andy, if I can just say, today I was on a webinar or whatever you want to call them with Mass DPH about Triple E today. They're supposed to send us out the presentations from the slideshow, and it actually shows a scale of when they're most active. And it's more like, as far as with the mosquitoes that would carry Triple E, are more towards they're thinking is going to be towards the end of July. So as soon as I can get that, I can send that to Kim if you like, and then she can also see it, and then they can try to make a judgment call from that.
Absolutely. That was something I was unaware of. I didn't realize that there was towards the end of the season, or the middle of the season, if you will.
Yeah, it kind of surprised me too, but it has to do with their habits of feeding and this and that, and but they're supposed to send us the copy of the slideshow tonight. So as soon as I have it, I'll get I remember what that particular slideshow looked like, that particular slide, and I can send it off to Kim, and you can that's what they're going to kind of run with this season.
Is that something you would like to see, Kim?
Of course, yeah. I mean, I don't know if, Jay ultimately gets to decide, since when the warrant's posted, the moderator gets to decide. But, I mean, we can't move the meeting again. So it's got to happen. So I think anything we can give that maybe can help decide what we do, I'll take happily.
Okay, cool.
Mr. Chairman, if I may.
Absolutely.
The end of July is in line with all the information that I've received. Basically, it will be here or showing up in testing a month earlier than last year, and it will be more severe. So that would make sense, because it really didn't show up until middle of August, end of August hard last year. So that would make sense that it would be the middle to end of July. Thank you.
Yeah, and Dr. Brown on the meeting today said that Triple E will run into a 2 or 3 year cycle. So this would be considered the second year of the cycle.
Very good. Speaking of Dr. Brown, different man, but how have we done with the tobacco stings? Have we had any lately?
We have not had any lately. We were going to have one, and COVID happened. But I do want to let you guys know that it went into effect June 1st, hard date of June 12th. The flavored tobacco had to be gone, and Lenny has also done compliance checks on that. And everybody in Mendon, when he went in before the 12th, everyone in Mendon had already complied. That means menthol, the flavored, everything, it's all gone.
Yeah, I saw that on the news also. Are you in front of your computer at this time?
Me, yes.
Do you, by any chance, can you tell me when the last sting was for the? I know the Mendon passed with flying colors, but I just want to make sure it doesn't go too long. I want to stay on top of that.
When you say passed, you're talking about when Elliot Brown did a compliance check?
Yes.
Okay, hold on.
Tom, you've been mighty quiet. You got anything to add?
I'm good, Mr. Chairman. Thank you.
All righty. Did your wife tell you about our conversation yesterday?
No, she did not.
I'll call you after the meeting.
Okay.
It was last October, Andy.
Okay, so it hasn't quite been a year anyways. I think we waited till school started last year just before we did it.
Yep, and then we were going to try and do it again because things had changed. But then when we were going to do it, COVID hit, and we haven't been able to do it again.
What are people's thoughts about right now with COVID and I don't see a lot of kids out. I don't know, maybe I'm out of town, so I don't usually see them. But at this time when there's no school or parks or anything like that, what are people, what are you guys thinking as far as, do you think that there's kids in the stores that might be trying to buy and stuff like that? Mom, do you have any thoughts on that?
Well, you know, I haven't really been actively thinking about it. I suppose it's a possibility that it happens. I mean, I think we're very fortunate in our community that I think it's very infrequent when the happenings arise. I think overall we've been very positive in that area.
All right, maybe we should leave it live for now. Alan, do you have any thoughts on this?
Personally, I haven't been in and out of too many convenience stores myself, so I really couldn't tell you what the traffic is like. But we don't have that many sources to begin with. And I mean, everybody has been, for the most part, kind of laying low. Even in, you know, convenience store parking lots, I haven't seen up until the last week the vehicular traffic that we're used to seeing in and out of those stores. And I think everybody, especially the school age kids, are sort of in summer vacation mode. So, you know, I think we'll be good. If we want to do it again in October, we'll be at the 1 year mark and, you know, see what happens then. Back to you, Mr. Chairman.
Sounds good. Thank you for your input. Okay, Missy, so we'll just put that to rest for now.
Okay.
But we don't want to let that. We've had great results in our stance on cigarettes, and I would like to stick with it. I can't think of anything else at this time. That we just had the two subjects and we've covered more. How about the minutes? We were going to review the minutes again.
I sent them out before, but the ones for all of April, I think I sent some out for May, but I don't remember. I can resend them in case you guys haven't, to make it easier for you to find them in your emails. And you can do that for the 24th if you'd like. Unless you know what minutes you want to approve.
Was there one you wanted to go over last meeting?
Not that I can recall. I'd have to review them. I do see the email that you sent a few sets of minutes. Missy, I just haven't had an opportunity to go through them yet myself.
Okay, as long as you have them, I'm good.
Okay, very good. If there's nothing else, could we get a motion, please? Lonnie, do you have anything else for us?
I'm good, buddy. Thank you so much. Thank you, everybody. Thank you so much for all the work you guys did. Thanks.
Thank you, Lonnie. Kim, thank you very much for your attendance and your help.
No problem. Happy to do it.
Obviously, someone's grandma called
Did I
her, I called her back. I talked to her for a little bit, and then finally realized that.
What the heck is that?
You. I didn't call Barry.
That's funny.
This is the wrong number.
Holy cow. Could I get a motion, please, if we're all set?
Number is one number off, right? The next two is.
I will motion
I can
to
make the
adjourn the
motion.
meeting this evening.
That's Lonnie watching TikTok. Lonnie, stop watching
All right,
TikTok.
I'll second the motion.
Oh, sorry.
Who's making
Good
the
evening, everyone. Alan did, Tom seconded.
All righty.
Good evening.
Very good. Have a good night, everybody. Thank you.
Good night, all. Thank you.